I was diagnosed with a kidney stone at the hospital.
And I was prescribed an antibiotic.
And from that one dose of antibiotic, I got C. diff again.
I have had recurrent C. diff for 9 years now, every year.
I lost my sister to this disease 5 years ago.
We were told she had an infection. Come to find out, she died of C. diff 13 hours later.
She died within a week, and we could do nothing.
And it took 5 emergency room visits before the 5th hospital finally admitted me.
I had chronic vomiting and diarrhea.
You're so humiliated and embarrassed.
Fatigued. Fatigue was how it really started.
I was sleeping 18 hours a day.
At that point, we didn't know what treatments were going to work.
I was no longer responding to any of the medications.
They were testing me for tick diseases and testing my hormones, testing everything. We don't know what's wrong with you.
I was facing the possibility of dying from it.
I thought I had better prepare my kids for this because I thought, I'm not going to make it here.
The more you recur statistically, the more likely you are to recur.
I was worried that I was going to spread it to my family.
I didn't understand how contagious C. diff was.
It was very isolating because I didn't know anybody else who had it.
I looked up everything I could and there was not enough information.
I almost felt like the doctor felt bad for me because he didn't even know what to say or, what to do.
People typically think C. diff is something that happens to the elderly.
I had contracted C. diff while I was pregnant with my son.
This disease is out in the community. It's not relegated to the nursing homes and the hospitals anymore.
It causes 29,000 deaths a year.
It's exponential, it's growing, and it's going to be one of those things that somebody will know somebody who knows somebody who's had it.
It can happen to you. I never thought it would happen to me.
Everybody needs to know about this. Parents, young parents.
It's incredible of how little education there is out there.
You have to be your own advocate in this day and age, or an advocate for your family.
I wanted to get heard as a patient, talking to other people so they know they're not alone.
I got in touch with Christian and I said, I've got to do something. What can I do? How do I stop this? This can't go on.
I contacted Christian right after my mom's death, and they were very supportive. We just loved what they were doing. Their site was a big help to us. We didn't know many things about C. diff. And now with the launch of the new website, it's just even better. I think just building upon a community, people will feel better about approaching us with stories. We're there to support them.
For people who have C. diff, you're not alone. There are other people who've had it, who've lived through it. There is hope for you.
This was really our focus, to make this a treatable, preventable, curable disease.
It's incredible to be a part of this team, to know that because they've taken the steps and have tried to start educating the public in general.
We can make an impact with healthcare workers, doctors, physicians, nurses, dentists, students in all those areas.
Being an advocate helps me be a part of honoring my mother.
I feel that this is the beginning of an incredible journey for a lot of us, and if one day we can look back and we've made a small difference and alleviated suffering, it'll be worth it. My mother's death is never worth it, but the effort will be worth it.